Hello, everybody. Thank you for joining again tonight as we continue our series on maternal mortality and really how to get yourself ready as you plan your pregnancy. Tonight, we're going to talk about postpartum depression and whether or not the question for you to ask yourself is, are you at risk to develop this? I will admit that this has been a difficult presentation to put together. Um, it's a very difficult topic. I'm not the expert on this. I do remember, counseling with women after they've had their babies to be watchful for the postpartum blues, which is somewhat normal to expect after you've had your baby. But when it goes beyond the blues is when it develops into postpartum depression. And so I want to go over all of this with you tonight. The goal for reviewing the risk factors for each of the concerns for maternal mortality and causes for maternal deaths is so that you can be more informed, that you can take a look at yourself, that you know yourself so that you're able to manage this whole healthcare system to your benefit for having a healthy baby as much as possible and also a healthy mom. So let's take a look at this topic. What I plan to do is to bring on a mental health professional later who can address this topic in more depth than what I might be able to do tonight. My goal tonight is to give you just a list of things to understand and know so that you can continue your self-evaluation that will be discussed in your preconception visit, and also for you to have for your own record so that you can continue to work with your healthcare providers that you are hiring to take care of you through your pregnancy and for the birth process. Let's get started. Once again, mental health is the leading cause for maternal deaths in the United States. 23% of women are dying due to mental health reasons up to the first year after they've had their babies. So this is nothing to joke about, nothing to sneeze at, nothing to not pay very close attention to. Women are dying. They're taking their life in some situations. They're having overdoses related to substance overdose. So we really, really need to take a look at this topic. I grew up, was born in the 50s, and that seems to be old for some people. But I do remember how life was before. I grew up in an extended family situation where aunts and uncles lived close by. They were generally the next house down. Grandparents were next door. Often when people got married, they would move in with their in-laws for about a year while they saved their money to be able to purchase a home and prepare for having a baby. I remember when babies were born, you would come home either to mom's house or to a mother-in-law's house, and you were literally told that you needed to stay, if there were stairs in the home, like for a month, you needed to stay upstairs. And during that time, you got waited on, you got your meals brought to you. And so this was what happened. And I thought this was so old-fashioned. And then as I continued to care for women, I thought about this. I'm like, oh, wow. Women actually got a lot of support to be able to sleep, to be able to bond with their baby, to be able to have healthy meals after they had their babies. Now in our society, we're no longer living in an extended family circumstance or situation. Parents are away from children. You're cross country in some cases. When the baby comes, you're having to take off work. Hopefully, parents can take off work as well, um, to come help care for this baby, to also the concern around maternity leave. How much leave do you have? For some people, their jobs, depending on where they work, may not offer maternity leave. And so there's all of these stressors around childbirth that we may not have had in older days when we did things kind of what we would call the old-fashioned way. And so with that, there's a lack of support for mom and dad as they're forming this new family. A lot of stressors and responsibilities placed on their shoulders where they're needing to go back to work, maintain household, prepare meals, be up during the night with a new baby, which is normal. It's just more stressful. And so because of that, both men and women are affected with postpartum depression. And this was kind of news for me. I knew that men had some symptoms that their wives had during pregnancy. That's called the Couvati syndrome. But I was not so much aware of the depression until I was reviewing information for today. So 1 out of 7 women are affected with postpartum depression. And we're talking about the postpartum blues. The postpartum blues we tell women to anticipate generally for the first couple of weeks after they've had their babies. But if it goes beyond that, then we got worried about the possibility of depression happening. So 15% of women will actually develop a postpartum depression. And some women can even go further and develop what's called postpartum psychosis. 18% of men are affected with postpartum anxiety, which is new. Men feel as well. And just as there are changes in the woman for hormonal changes after she's had her baby, believe it or not, this was news to me, men also have changes in their hormonal structure. The testosterone goes down. They have more estrogen-like hormones produced. And so there's a change in their bodies too. So that was new information for me. So we have to look after our dads just as much as we have to look after our moms. When you look at what are the things causing postpartum depression, first is there a history at all of any kind of anxiety or history of depression? And this is for both, for the mom and for the dad. There's a lot of life stressors that I just talked about previously. Are there relationship problems? If there are relationship problems, that will feed into this postpartum depression. Are there problems and complications in the pregnancy? Some couples have experienced difficulty with becoming pregnant, and that has its own level of anxiety. And then once pregnancy happens, then there's another level of anxiety of being able to go through the pregnancy without any complications occurring. But when complications happen, then there's concern and worry over the health and well-being of the mother and the baby. And so anytime there are any complications during the pregnancy, that will also bring on anxiety that can lead to postpartum depression. For men and for women, the symptoms are very similar, very much the same. If the woman is depressed, the man is going to have an increased possibility of depression. Emotional triggers will cause postpartum depression in the father. Lack of sleep. I want to emphasize this lack of sleep. I remember in my earliest job as a nurse midwife at Booth Maternity Center in Philadelphia, Pennsylvania, I remember Dr. Franklin deliberately having a woman admitted back into the hospital after she had gone home with her baby. What had happened was she was going into depression and maybe a psychotic syndrome. And he had her husband bring her in. He sent the baby home with the husband and his family. And he deliberately provided medication for her to be able to sleep. I remember that so clearly. And it was an incredible example of how lack of sleep can really affect someone after they've had their baby. Other things are hormonal shifts. There are hormonal shifts in both the woman and the man. If there, again, has been any sort of history of depression and anxiety, and then lack of support from the family, from others. One thing that I want to say is that we are often so anxious to see a new baby once the baby is at home, and we kind of forget about the need of both the mother and the father to be able to rest. We also forget about the need that they need to bond together as a new family. And so we need to think of that as we consider our desire to see this new baby. The depression can provide signs that are the same in both the men and women, where there's irritability, there can be mood swings, crying when you're just overwhelmed. I know that happens to me when I'm overwhelmed. There can be changes in weight, either gaining weight or losing. People have different appetites when they're under a lot of pressure and anxiety. For me, I eat like crazy. For others, they don't eat at all. And so that's something to watch out for. If they're not finding themselves being attached to the newborn, these are signs of this postpartum blues now moving into a more serious state of postpartum depression. So, what can we do? Well, there are things that we can do as individuals, both men and women. There are depression screening scales that are available. I have provided the links in the presentation, and they will also be in the description below the presentation as well that you can come back to. But there are two screening tools that are used. One is the Postpartum Depression Screening Scale, which has 35 items that will help to look at varied aspects of postpartum depression. There's also the Edinburgh Postnatal Depression Scale. These are 10 questions that ask about the mother's thoughts and feelings over the last 7 days. So this is a questionnaire that you would repeat even after you've done it the first time. You would repeat it again later. I want to say that there should be absolutely no concern about asking for help if you feel overwhelmed as a new parent, whether that's father or mom, that you talk about this amongst yourselves. I also will ask family and friends to be very sensitive to new families. Even when I say new families, I'm not talking about with the first child. With every child that comes into that family, to be sensitive of the needs of the family. There's the need for them to bond together with each other, with mom and dad, and if there are other children in the family, to have time to bond there. There's also the need for rest. I would say to my patients, this is going to sound a little crazy, but it's not. I'm thinking back to the old days when you would come home, where you would be told to go upstairs, not to come down, to rest. And what I have advised women to do is to stay in your nightwear for at least 2 weeks. Because the minute that you get into real regular clothes, people think that you're just fine, that you're doing just fine. And so they will have expectations of you to do housework, to do cooking, to do all the things that you would normally do prior to having your baby. When you continue to wear your nightgowns, pajamas, it's an indication that I am resting. I need to still rest. Even though you're not sick after you have a baby, your body has undergone a very fantastic transition. You've birthed a human being, but your body also has to get back to normal. It takes time for your body to get back to normal. Believe it or not, it takes 6 weeks for the uterus to totally heal. So these are the things that I want to strongly recommend is have friends and family bring food for you. If they want to know how can they help, let them, instead of them trying to hold the baby or whatever, have them bring meals and give you time to rest. Store up meals prior to having your baby so that you can rest. Determine times when you're ready to have family, but it doesn't have to be the first or second day. It may be 2 weeks out, and that is okay. Look to have friends who are going to actually come and help you, say with house cleaning or with chores around the house, not just come to visit with the baby and exhaust you. We know that as much as we love our friends and family, they're exhausting. And we don't know how to say, I need a rest now. I need to take a break. So these are the recommendations that I have. Again, I'm going to try to have a mental health professional on at a later time so that we can discuss these things more. So I hope that this is helpful to you. Please pay attention to the questionnaires that will be below. Please share this information with your family and with your friends. If you've liked what I have provided to you tonight, I hope that you will subscribe to my page. We have more content that's coming, and by subscribing, you'll be able to know what's coming up next. Tomorrow, we're going to talk more about another cause for maternal death, which is cardiac disease. And we're going to look at weight gain during pregnancy because overweight can be a contributing factor to heart problems during pregnancy. So thank you again for joining with me. Please, if you have any comments, please let those comments, write them out. I'll be happy to respond back. But have a good night and thank you. Bye-bye.